Okay, whew. I was like, please cooperate with me today, technology. Double checked. I'm like, okay. I'm like, I shouldn't run out of battery power this time, so we should be good. So, and then I've got it set up on my side, so I'll submit the Word document for this week and the video link in it. So, got that taken care of. So, we can go ahead and start. So, we'll just kind of do what we've been doing. I'll present my case and then you'll present yours and then I'll present my last one.
All
So,
right. To remind you, I wasn't able to study all the lessons. It's hard today. Like for this
it's
week, oh, because we have a lot of
too many diseases. Too
yeah,
many. And
exactly.
it's like I can finish up with all my schoolwork for like that week on Saturday and immediately start reading and still not be completely finished with everything by the time the meeting rolls around. Like it just depends. Some weeks I'm really good and I can get everything read and some weeks I can't. This happened to be one of those weeks where I didn't quite finish everything. So I was like, okay, based on what I've read so far, let me just make up case studies about what I've read. So makes it a little bit easier. So it's understandable. Sometimes it's just hard to get through all of the reading for the class. I get it. I
Yeah.
I get it.
If for example, I have this course like I like at the end of the semester I have this D. So D means I didn't pass, right?
Yeah, kind of. I mean, technically, no. I mean, you didn't get an F, so you didn't fail. I think their like requirement is like a C or C minus. I think I'd have to double
Yeah.
check and see.
So if I got D and I'm going to retake, is it possible to retake or just forget it?
It is very well possible to retake the course, or if you don't feel comfortable retaking it, you might be able to take a course that fits that whatever the requirement is. Um,
Oh, okay.
so I understand. There's a financial class I have to retake for my degree, and I'm like, I'm not going to do that right now. That one's going to wait a little bit longer, but yeah, you can retake them to get that higher grade to at least get the C passing. So it's it can be done. They've got it set up so you can do it. So it's a good thing. So if for whatever reason something happens and you don't, pass this time around, take a deep breath. It's okay. It doesn't mean you did bad. Sometimes classes are going to be a little bit harder than others. So it's just you take a step back, take a deep breath, and just, move forward. If you have questions or concerns, always reaching out to an academic advisor is like good. Because I've had to do that many times before where I'm like, I don't know. Do I retake this class? Do I do this? So yep, academic advisors will always be super helpful to you when you kind of are like not know what to do with the classes and stuff. So it's all good. But hopefully, hopefully, I didn't make these cases too complicated. So let me go back here. Did I am recording. I almost thought I wasn't recording, and then I'm like, oh no, I am. It's Thursday, but it's been a rough day, rough week, rough day, and rough week. Right. So we'll go ahead and start with my first case. So, 60-year-old male is presenting with slurred speech. The left side of their face is drooping after we have asked them to smile. So, after we've asked them to smile, we notice that their left side of the face is drooping. He is also stumbling and experiencing speech impairment known as dysphagia. And he has arrived in the ER after his spouse called 911 after seeing visual symptoms of slurred speech, not balance, some poor coordination. So, based on that description so far, what do you think would be the diagnosis?
6 year old.
Yep, 60-year-old male.
60 year old, right?
Yep, 60. Yep, sorry. Sometimes my it doesn't come out the way I thought it does. So, yeah,
Uh-huh.
60-year-old male, and he's come into the ER after being brought in by ambulance because his wife called 911.
Yeah. All right. So, okay. So I think it's is it a stroke or a cerebrovascular accident?
Yeah. Which, by the way, when I was reading, I'm like, I don't like the technical term is cerebrovascular accident. I'm like, I don't want to call it an accident.
Yeah.
I don't
Yeah.
like that that's called that. I'm like, I'm just, no, we're going to call it what I know it has, which is a
A
stroke. You
stroke.
are
Yeah. We
100%.
are familiar. I am also familiar with that.
I'm like, I've never heard of it called as that before. So that threw me off when I did the reading. I was like, it's a stroke. That's what it is, a stroke. So, with this, what do you think was done diagnostically to determine that it was a CVA or a stroke?
All right. So based on my reading, it says we have to determine their comprehensive history. Yeah. And also physical examination, like um and also we can use MRI, MRA. Yeah, may be used. Yeah.
Yeah,
It will be suggested. Yeah. And also we have to do a neurological examination too.
yep, yeah. And like I said, the first people that are going to notice that something is going on is going to be the people that are going to call 911, the wife,
Yes.
the kids, or somebody at work, because it's
Yeah.
going to be easy to tell that there is something wrong
Yeah, right.
because there's the imbalance, there's the drooping of the face, slurred speech,
Yeah, right.
so it is very very visual at the beginning, but you still have to do diagnostic just to kind of rule out other things it could be. And this, you have to ask facts fast with the with strokes and stuff, because when it happens, you lose part of your brain, like parts of your
Yeah,
brain. You
yeah.
lose some functions in your brain. And again, I always seem to choose case studies that I have a lot of information or have had experience with because my dad 4 to 5 years ago ended up experiencing 2 mini strokes, and he was very stubborn and didn't wanna go to the hospital, and my mom's like, "No, we're calling 911, you're going to the hospital," but he ended up experiencing 2 very small ones, and is very lucky that they were small, but you could immediately tell something was wrong. His face was drooped. He slurred speech and he was kind of struggling to string a sentence together. So, my mom's like, she's like, call 911 because she was on her way home from work. I'm home working on schoolwork for another class, and I just something appeared off to me, and I heard kind of like a thud in the bathroom, and I'm like, "What the heck?" He had lost his balance and had fallen. So, it was kind of a bit of a process, and we get him to the hospital and everything like that, and they do the diagnostic testing and everything. They're like, "Yeah, he had too many strokes." And since that, I mean, they got it and they caught and noticed what it was in enough time and started, you know, what was necessary to treat him. So, but he still, unfortunately, there are parts of his brain where he just doesn't have that function anymore. He kind of struggles sometimes with some words or remembering what a word is. Um, so it can be very scary. Some people, if you have a stroke, and you survive the stroke afterwards, you can have more severe brain loss. So it's kind of like you have to act fast to like try not to prevent death or brain damage. And for a while there, he had to go in every year to have a brain scan done to make sure that to make sure his brain was still okay. And, he had to go on an aspirin and stuff like that, which leading into talking about that kind of leads into talking about the treatment plan. So obviously, if you're going to be taking aspirin, what kind of medication is aspirin? Like, what treatment plan would this be for somebody who's had a stroke?
The treatment plan. This is a medical emergency,
Oh
right?
yeah. Yep.
Yeah.
Yep. That's why when you notice the signs of somebody having it, you have to immediately call 911
Mhm.
because it's such a severe and big medical emergency. Obviously, treatment's always going to be call 911 first. big thing. So with
Um,
doing that, they figure out, they do the diagnosis, then what would the next steps be for treatment after that's happened?
yeah. And it says here on the PDF, it says drug therapy
Mhm.
and anticoagulant or antiplatelet agents.
Yep.
Is that a kind of medicine too?
Yeah. So there are
Like
certain medications.
like they're going to put on the mouth of the
Yep.
patient
Yeah.
to lower, because you see most of the patients that are having this stroke, they are those who got hypertension,
Hmm.
you know, yeah, and who got high cholesterol,
Yep.
diabetes, yeah.
Yep.
And while you are explaining this one, I am also in maintenance because I have a high blood pressure or slash hypertension. So if I will not be, um, if I'm not taking good care of myself, of my body, maybe this will really happen.
Yeah.
Possibility, right?
Yeah.
This,
It's something you always have to think in the back of your head of, taking care of yourself, because not taking care of yourself puts you at a higher risk for having certain things like this, especially because it deals with the blood vessels in the brain and stuff like that. You have to be super careful with your hypertension, your cholesterol, what family history you kind of have to keep aware of. So you're taking anticoagulants, you're taking, those other medications, after you have a stroke, are supposed to, kind of help prevent future ones from happening. But before it, you kind of want to kind of just really just take care of your health and just kind of periodically kind of just, always check in with your doctors, saying, hey, my cholesterol is this, my hypertension is this, like, kind of, is the medication I'm taking okay? Is it working? Is it going to kind of help prevent from the risk of having stroke? It's always, you have to work for your doctor to find out what's going to be okay for you and for what's going on in your health to kind of prevent something like a stroke or anything else happening. So it's strokes are very scary when they happen, because in the initial time you don't know what's going to happen. You don't know if the person's going to survive the stroke. If they survive the stroke, how much function are they going to have, or is the possibility if they don't survive the stroke, and it doesn't even have to be somebody in their 60s. It could be somebody young could have a stroke. There was a actor who I loved to death. His name was Luke Perry. He was a good looking dude back in the 90s, kind of heartthrob, and he'd been in a like 90210 and stuff, and he had been on a show that I loved called Riverdale, and played a really cool character on there, and he had a stroke and died. And like, he had no prior health issues. Like, he hadn't done, you know, he hadn't done drugs or anything. He hadn't done alcohol. He didn't have those big indicators. And he was like in his 30 or 40s when he had the stroke. And it almost seemed like he was going to be okay. And then maybe like a day or so later, he was gone. So it's treatment plans are really also dependent on how severe the stroke was. Is it a minor stroke? Is the anticoagulants going to work? Do we need to do something more? If the person has a stroke, do they need to do physical rehabilitation? You know, it's the treatment plan's like it's just a combination of drug therapies and kind of physical rehabilitation, and you kind of have to still check in with your doctor. You may have to have scans like my dad did, where you check your brain function, see if you
um,
know something's coming up. So yeah,
yeah.
it's in my dad's side of the family, I don't think there was a family history, but one of my aunts, so one of my uncles, who's one of my dad's brothers, had a stroke. So it's not in the same bloodline, but it almost kind of made you have like, and she had it like, gosh, 30 years ago was when she had it. So it's kind of like, you have to always kind of double check your family history as well because, strokes can happen on either side of the family. And it's just it's a hard thing to deal with. It's this I think honestly this week's course has been the hardest one for me because a lot of it deals with the brain and stuff and I'm like yeah, it's scary. So we did good. We figured that one out. That was not too bad. Like I said, it was easy case study for my brain to remember because I was like, I gotta know how that is because I've had experience dealing with it before. Not myself, but
And
my dad. But he's
yeah.
doing good. He hasn't had to have a brain scan in a while.
Oh.
So
Hmm.
he still has to take the anticoagulant medication. He still kind of has to be still mindful, and there are times where he can't remember a certain word or phrase, or he just can't remember something in general. Like you can tell him something and he'll forget it 5, 10 minutes later. It's unfortunate that this can happen, but there are some good prognoses that can come out of it. It just, like I said, always depends on how severe it is. So that's my first case study. I did it kind of real simple-ish, and then I kind of word vomited because I know too much about it. So, all right. And now I'm going to almost drop my laptop, but okay. Let's go on to your case study. See if I can figure out
Yes,
what it is.
you can really figure this one out. It is easy for you. All right. So Michael, he's a 61-year-old senior partner in a law firm. So while they are eating breakfast with his wife, he experienced sudden onset slurring of his speech, had a facial drop on his left hand side with weakness in left side upper and lower limbs. So when Michael's wife spotted this sudden onset of symptoms, he called for the ambulance or
Did you
911.
did you do stroke too?
Yeah, that's why when you have this so I said, oh, we have the same we
Oh,
have the
that's
same.
too funny. Yeah, see, it's that is hilarious. I didn't think that that was gonna happen, that we would end up both having one of the case studies be
Yeah,
the
first
same.
time, right, isn't it? And I'm trying to find a case about baby shaken syndrome, like,
Hard.
yeah, because I there are few of the cases of those like when I browse my Facebook, like how many months have passed. There is this couple, they are complaining of their maid that the baby died because of
Yeah,
excessive. Yeah, so I'm trying to find that one because I'm trying to find the symptoms and what happened to that baby to be reality, like, oh,
yeah,
I really have to find this case, but I cannot find it.
yeah. There have been like some cases of shaken baby syndrome that have like made it to like headline worthy and stuff, and it it's interesting to see what happens because sometimes it could very well be an accident that may occur, but more often than not, it's been not an accident that's occurred. So shaken baby syndrome is such a hard one to do because there is they're quarreling sides. The one side saying yes, the child died because of shaken baby syndrome, and then somebody else would be like, no, there's not enough force that would cause it. So it's like bickering back and forth. And I wish I could remember the name of the case that I remember where it happened, where it was like watching it myself. Like I watched a documentary on it, and I still like to this day, I'm like, I don't know. I'm like, was she guilty of it? It's hard, but
Oh, right,
it's
yeah.
just yeah, when you get these diseases and stuff that happen, sometimes it's like, how is it determined that it's, an aggression that happens if the parents do it, or you don't have enough real life cases to kind of help you understand exactly what the disease is and stuff. So it's like reading about shaken baby syndrome is like I kind of already known about it, but I'm like, there's just not enough kind of information out there about it. So there's more information if there's more information about like strokes and everything else that we've talked about and read about this week, but shaken baby syndrome is just not enough. And I just knocked over my cell phone.
Yeah.
I forgot what that
Like,
noise was. Oops.
oh,
There we go. Okay, almost, almost. Get over it, get over it, get over it.
I can't hear it anyway.
I knocked it off my edge of my bed and I'm like, whoo, don't do that. So let me go back here. So if your case study was about stroke then, because we kind of were similar, I guess, we we could just go ahead and move on to mine if you want, since we kind of already have discussed a stroke and how it's diagnosed and everything. So we can go ahead to my case study if you want. That was kind of an easy little thing. Uh-oh, did I lose you? Okay, you're still there. I thought I lost you for a second. I was like, oh, please don't tell me the internet freaked out. So, yeah, did you want to go ahead and move on to the last case study then, since we kind of both had stroke as one of our case studies?
Do you want me to change it?
It's up to you. Do you want to try and change it? I mean,
Oh,
it,
then
I, like I said, I don't want to stress you out and make you feel like you have to change it. I mean,
it's all
it's
right.
bound to happen that at some point you're going to have one case study be the same and
Yeah,
um,
so maybe the checker will ask us, oh, you have only two because you have the same case study, isn't
I
it?
mean, if it comes down to it, I will be like, well, I'm like, it would have been hard to try to get another case study done within a certain amount of, time. I'm okay with just having that first one of mine and yours kind of being combined into one because we kind of both did the same thing. It did stroke. So we can definitely go ahead and just move on to the last one.
Okay, so you're all right. So y- I will try to find one while you are trying while you are stating the second one. Let me find another case.
You're good. Let me go back over to here because I lost my spot. I moved out and clicked in the wrong thing. So, okay, there we go. All right. So, a 16-year-old child presents with dizziness, nausea, and headache after experiencing a hard hit to their head at the skate park. He is exhibiting shallow respirations. His pulse rate is depressed. Then there is a brief moment of unconsciousness where, after regaining consciousness, the client experiences some amnesia and blurred vision. So, what do you think would be the diagnosis on this one?
Is my mic on? Um, is the patient having seizures?
Nope, no seizures.
Oh, no seizure.
Nope.
So the signs and symptoms that you said about is that
So, dizziness,
dizziness, yeah.
nausea,
Uh-huh.
and headache after experiencing a hard hit to their head at the skate
Oh,
park.
all right. So they have dizziness. What about their speech?
Speech is fine. They do go
Oh,
unconscious for a period of time,
hmm.
but then after regaining consciousness, their vision is blurred and they have some amnesia, which means they're kind of, you
Oh,
know,
wow.
not knowing who they are kind of thing or where they're at.
All right. So I am guessing, is this subdural hematoma?
No.
No. All right. So let me find another one. They are having a nausea. Oh,
Mm-hmm.
wait. did I forget about the vomiting?
Vomiting can happen if somebody does experience this. It can happen. Usually it happens after consciousness has been regained. So if they go unconsciousness, regain consciousness, they can be having vomiting, blurred vision, amnesia, stuff like that.
Oh, amnesia. All right. Amnesia. Amnesia. Did I? Oh, what is my guess again? Not epilepsy is not right. How old is the patient? I forget. Sorry.
Nope, you're good. 16 years old, so he's a teenager.
16.
Yep,
Okay, 16. She's young.
yep, they're young.
So if 16 and if she's having breathing and paralysis and weakness, but there's no problem with their speech.
Nope, no problem with the speech. They're just having the nausea, the headache, and some dizziness after experiencing a hit to the head while at a skate park.
Vomiting, but there's no seizure
No
and
seizures.
yeah. And all right. So what about tumors of the brain? Is not?
No,
Yeah. Oh,
no, but
yes.
it's okay because I kind of made this a little bit trickier because it could be an array of different things. So
Yeah.
you're good. So
Yeah. Right.
it would be considered a cerebral concussion. So basically a
Oh,
concussion
cerebral
happened.
concussion. All
Yep.
right.
You will see these with kids, you know, participating in sports,
Yeah.
older people
I think
participating in sports.
I write that down, but I forget about it. Yeah, I
You're
forget about
good. Yeah, it if you're not if you're not being careful, you can experience these, especially with teenagers because,
yeah.
teenagers can be a little bit reckless and sometimes don't like to wear helmets and stuff like that. And so, but it could have been it could have been any one of the other things you listed. So you kind of were, thinking almost in the same area, but different things. So,
Yeah. I forgot about the term amnesia.
yep.
Yeah. So yes, cerebral. I should have highlighted that one.
Nope, you're good.
Yeah.
So for this
But
type of
yeah,
thing,
yeah.
let me go back in here. I just had my phone and laptop both freak out on me on the same time. I'm like trying to move things around and it goes, nope. So for
Okay.
a
Good. This is a good.
concussion,
This is a good. This is a good. What do you call this one? This is a good sign. Some symptoms. Like if you forget one of the key word in there, you will guess.
you
But
kind of, yeah, it
yeah,
kind of throws you
because
off. You're like, you think it's this, and you're like, oh, wait, nope, it's the other thing. So,
yeah, right.
yeah, all right. I have to do Control F because I've scrolled through and misplaced
Yeah.
my notes. So I have to go back in here so I can get this pulled back up. There we go. I was like, I'll get there. I'll get there eventually.
Yeah.
So if we're going to determine that it's a
The diagnostic.
cerebral concussion, I can't say that one today.
Yeah.
So
It's all right. It's all right. But actually, when I am writing this down, I stop. That's why I don't have, and then I'm going to the PDF for.
yeah, no, you're
Thank
good.
you. Thank you for this kind of That's why we have this kind of report, yeah, to remember the cases that we have.
Right.
Yeah. So this is a wonderful case that you presented.
Oh. So if we're doing this, if we've
Yeah,
determined that it's a cerebral concussion,
yeah.
how would that have been diagnosed? What would we have need to have done to come up with that diagnosis as the doctor?
So the patient will go under physical and neurological assessment, and then we have to order maybe CT scans and MRIs.
Yep.
Either of these will apply to the patient.
Yeah, it did mention in the reading that it says like cranial CT scans usually reveal no evidence of brain tissue damage.
Mm-hmm.
So usually it says MRIs
MRIs.
you may be better. So
Yeah.
but usually, the symptoms that they're experiencing, losing consciousness, regaining consciousness, kind of will be like, oh, yeah, this is what's going on. So concussions are not as scary as other injuries to the brain. So
Yeah.
it get keep but, but that doesn't mean that you don't need to be cautious. So if we've determined by doing all the
But if,
scans and stuff that it's
but
this concussion.
yeah, but of course, if you are having this one, or if you have a patient having this one, or a family having this one,
Mhm.
you will be really scared, or
Yeah,
I don't know the feeling that you will have, because
it
they will they after the impact on the head, and they will
yep,
lose consciousness, and they will have amnesia. You'll really think that, oh, this is a serious one.
yep, you do have to be careful though, because there are things that it can start off as a concussion and go worse.
Yeah,
So
right.
it's like you determine the diagnosis is like, okay, we do all these tests, this is what it is. So it's like, okay, you have to determine treatment plan. So it's like usually bed rest may be enough, but typically you still need to watch the patient. Like the doctor is
Right.
gonna have to watch the patient because there could be changes in the behavior that
Yeah,
it could
exactly.
be progressing into something else.
Mm.
Um, especially if you think of like in the United States, and we look at like football, like
Mm.
they wear helmets, yes, but concussions can still occur with these players if they're getting hit in the head. These
Mm.
concussions, if they keep happening repeatedly, aren't watched, stuff like that can lead to, I think it was called like CTE or something was the name of it. And it like a concussion can lead to this where your behavior changes and you can become aggressive and stuff like that. And it can, and sometimes, be fatal if you get this. Gosh, I wish I could remember what it was called. It was like, I think it's like abbreviated to be CTE or something, but there was a whole like movie with Will Smith in it that was called Concussion that talked about this. And,
Yeah.
there have been players that have died in real life from
Yeah,
getting,
because this, yeah,
repeated hits to
especially,
the head is only your
yeah,
brain's not
if
gonna be
it's a
okay
head,
for so long.
yeah,
So, yeah, they say bed rest is usually okay, but you still have to monitor the patient because
exactly.
it could progress into something worse. So, you
Right.
kinda have to watch, they can gradually return to daily activities, but you kinda have to keep an eye if there's pain that's
Mm.
mild, you can take care of the pain, but
Mm.
it's kind of just you have to kind of just, as I like to say, the waiting game, kinda keep an eye on the patient,
Yeah,
see if there's
we
any
have to
changes.
really observe them, and again do.
Yeah, it's
Uh,
and, it is extremely terrifying. Sorry, I was trying to talk and had a hiccup at the same time, but what
it's
your
a,
brain can do to what your body can do to your brain is just terrifying and amazing all at the same time because
mm,
you can have your strokes and survive from your strokes. You can experience a concussion and be fine, or you could lose major functions in your brain that you can't do anything anymore, or you have a behavioral change that causes you to be aggressive. And it's terrifying. I mean, I think that's why I struggled with reading this week, is just because mentally, emotionally, it was a hard thing to read about because there are some preventative measures to it, but it's still kind of like a
yeah, but sometimes the blow,
not
even
always
though
going to
we
be
have the,
preventable.
yeah, exactly. Like even though we have the head protection, yeah, it can
Mhm.
only protect us slightly. But of course, if the blow is really hard, sometimes the protection will,
Yeah, it's
yeah.
it's it's crazy. Okay, I figured out what the name of that. Okay, so it was a movie. The
Yeah,
movie was called Concussion. It came out like in 2015. So it's basically, I'm gonna go over to Google because I can't remember everything.
Google
So
bro.
basically, it says while conducting an autopsy on former NFL football player, Mike Webster, a doctor, forensic pathologist, Dr. Bennett Omalu, who's played by Will Smith, discovers neurological deterioration that is similar to
Mm.
Alzheimer's disease.
Oh, Alzheimer. Yeah, because they
So
keep on
it's
forgetting,
yeah,
isn't it?
so it's
Yeah.
similar. It kind of almost mimics it, but it's not the same thing. And I think it was like uh trying to remember it, like I think it's CTE. It's gonna drive me insane because it can come from uh too many hits to the head. It can be
Yeah.
you know, and it's you wouldn't think about it because you're like, okay, well, comparing football helmets to what they were, 30, 40, 50, 100 years ago. Yeah, there've been improvements, but that still doesn't mean that there's not going to be problems, and that's why, I love watching football. And don't get me wrong, I love watching football, but every time a player gets hit, I'm like, I get so nervous. I mean, it's crazy.
It still have an impact on them, even
Yeah.
though they have protective gears.
Oh yeah. I mean, and if you get hit, and even like not even talking about the brain, like you can experience a heart attack by being hit hard in the chest. Like we had DeMar Hamlin, who was a football player for the Buffalo Bills, got hit. Like he got hit at just the wrong time in his chest. After a play, he kind of you see him wobble and he falls back on the field, and like he was like dead on the field for like I don't know how many minutes, and they got him to the hospital and he recovered and everything like that. But you just can't ever be too careful, because you can do all the padding, have all of this, but it still doesn't mean that something's not going to happen. So I figured out what the name of that disease was. So it was chronic traumatic encephalopathy, or CTE. So it's basically getting so many hits to the head, causing concussions, getting it over and over and over and over again. It can cause this. And it gets to a point where it's very much like Alzheimer's, almost to that kind of point, kind of mimicking that, but you can get very aggressive. Your brain kind of turns against you almost, and it's terrifying. Like I watched this movie with my parents and I was like, I love watching football, but maybe I don't want to watch football anymore because it's so scary, but
Aside from football, what is sports you really love to watch?
right? I love me some football, but I'm like, maybe I need to switch to something else. And I'm like, no, because any sport you're gonna watch is gonna have to be careful about getting injured. Even ice skating, you can, like for me, I love football, whether it's NFL or college football. I love that. I love ice skating.
You know how to ice skate? Do you know
I
how
don't
to?
know how to do it because I'm too clumsy to do it. I can do it. I choose not to because I'm nope, coordination's not there. I can't do it. So I will watch people ice skate more.
Yeah.
But I appreciate what they do, gymnastics. I love watching, gymnastic player, do their moves and stuff like that. But I'm like, you can still have so many things happen to you even if you're taking every precaution. And they're supposed to be NFL. I think it's NFL has set concussion protocols happen that if you immediately see something going on with the player that they are not supposed to be playing for like X amount of games, or they need to be removed completely. And there's been some concerns recently that have been raised, I think within this year, that the protocols aren't really being as followed as they should be, because there has been a player who has had some really recent scares where he really should be playing and he's ended up playing, and I'm like, you got to be careful. Nobody's life is worth the money that you get from playing these sports. Like you have to think of like the human thing. You're all humans. We're all humans. We all, have families and stuff. And so it was scary because this player, like, you could visually see in clips where he is like not he is on balance, he's not doing okay. And I'm like, I'm like, he needs to be removed for I don't know how many games he shouldn't be playing. And like a week later he was playing. I'm like, no,
Yeah.
no. But
Mhm.
going back to DeMar Hamlin, who's the guy that got hit in the chest, he did experience a cardiac event. And
Mhm.
you know, you see the impact, you see him go down and the entire stadium goes silent. And they're working on the field to try and revive him, and you see his teammates all, like, just in shock. Some are kneeling, and then as the ambulance is taking him away to get him to the hospital, you see the, his teammates and everything kneel on the ground and start praying. And then you see the other team on the sidelines praying, and, you know, they were like, "Okay, you're excused to go back to the locker rooms," and so both teams go baback to the locker rooms, and the head coaches of each teams go to each other, and they're like, "We can't play this, we can't." They're like "We gotta," you know, because they expected them to go back out on the field and play, and the head coaches just looked at each other, got together, brought both teams together, and they're like, "No, we're not doing this," and so they had to fight to have the rest of the game suspended because 'cause they're like, "We
Yeah,
ca" I'm like, "How are you supposed expected to play when you see your your teammate go down like that?"
yeah, yeah, of
Yeah,
course.
it was so terrifying. Like I don't watch that team. I don't watch the Bills team, but I had seen enough clips online that I was just shocked. I was like, "What?" And, you know, it was touch and go there because you didn't know if he was going to survive or not. And these doctors, like, and the staff there worked so hard. And, like, I think ultimately what saved his life is the medical staff that was at the stadium that was on that team. Because who, you know, he could have died and, you know, he could have not come back from this. And he's come back and he's playing again and everything. I'm like, man, if that happened, I would not play again. I'm like,
I
no.
will quit. I will really quit.
I'm like, nope, mm-mm.
I
But
don't
like,
want to go back anymore.
it was really cool though because I mean, this was like I think it was a rivalry game or something. I can't remember what the other team was that the Buffalo Bills were playing against, but it was like both sides coming together, both fans, like, you know, kind of leaning on one another. You've got the opposing team at the hospital outside, you know, praying for him and stuff. And I was like, ah, there it is. There's my faith in humanity
That
restored.
is yeah, like outside of sports, even though you are both team fighting for, fighting fighting for, for the game, but when somebody is hurt, you
Yeah,
will see that they are united in that one.
yeah.
Yeah.
Nobody's life should be above, you know, should be less than, you know, everybody's life is important. A game should not be above their life. And, you know, the NFL like kind of was like they were going to be in trouble with a lot of people because fans were pissed off. They're like, they can't go back and play this game. And the NFL wanted these teams back on the field. And they're like, no. So it was like after they had seen the uproar on online, they're like, the game has been suspended. I'm like, yeah, I hope so, because that would have been dumb for the rest of them to play because nobody wanted to play. So yeah, it's just like I said, sports are just so scary and crazy that you could, you know,
So while we are talking about this, I am those players fight like Manny Pacquiao, those boxers, once they
oh
hit, they
yeah,
were also hit in the head.
yep,
Oh, they will also be experiencing this one. It is possible.
yeah. You can get the chronic traumatic encephalopathy, wherever you say it, the CTE. It's
Yeah.
not just football players that experience it. It's boxers can get it. Anybody that is experiencing concussions over and over and over again,
Head
you know,
trauma. Yeah,
your
right.
brain can only handle so much, and it gets to a point where it just
Yeah.
can't handle, you know, and it kind of has its breaking point. So, like I
I
said,
Yeah, I found one. I know. I found one. Sorry, I found one case. They want to.
let's see if we
They
can
want
figure
us
this out. Since
so we can exchange that to the to
right,
the school, so that the checker will see. Oh, they have three
right.
cases. Not this, but
All right,
really.
so let's
And,
see. Lay it
yeah.
on me.
And what is the title before we go to the case? What is the title of that movie you're sharing? That Will Smith played. Can you?
It was called Concussion.
Oh, concussion.
You know,
I'm
it
going
came
to
out
try
in
it. I'm going to. I'm
2000. Yeah,
going
it came out
to.
in 2015 is when it came out. So it's been
I I hope that movie is in Netflix.
gosh,
I hope.
I don't remember where it is. I'm like, where can you watch it
Because
now? I'm like, it's been so long since I watched it. I'm like, let's see. Uh, Amazon Prime,
all right.
YouTube.
So Oh
Woo.
yeah, in YouTube.
Yeah,
Okay.
it's
Let
like
me
three
find
ninety
let me
nine on
find
YouTube.
all right. So are you ready for the case? I know you will really be good at this one because you're
Oh, I
good at
hope so.
oh yeah,
I
because you're
may
good.
not be, but let's hope and try.
That's why I have the best partner in the
Oh.
whole wide world. So thank you for being my partner here. All
Aw.
right, so we will name the client Miss Z.
Okay.
She is 30-year-old pregnant female. She is a recreational badminton player. But when she woke up, she got the inability to voluntarily move the right side of her face, including the inability to close her right eye.
Ooh.
Yeah.
Ooh.
And a slight drooping at the corner of her mouth. Like you can
Ooh.
imagine, like she cannot close the right eye.
I think I know what it is, and
Yeah.
if
And
I'm right, I'm gonna be really surprised because I almost didn't think I was right, but is it Bell's palsy?
yeah.
The only
So yeah.
reason why I remember that is because I had my cousin had a son who experienced that,
uh-huh.
like right before he was gonna go on his
You
mission.
got it. You got it correctly because you see when Miss Z is trying to explain this to her husband what is happening, she got a lot of control to enunciate words,
Yeah.
because of course
Yep.
her yeah her mouth is also yeah, so the husband thought she was having a stroke, but it's not a stroke. You got it correctly. I
Yeah,
told you
it
you got good at
yeah. Woo, I did it. My brain remembered. Yeah,
yeah,
I had my cousin, her son, like experienced that like
yeah.
right before he was supposed to go on his mission, and he's like,
How old is he? Like 19 or 20?
he was, I think yeah, he was 19 if I remember correctly.
Oh yeah, she's so young. And
He got the baby.
did she did she continue her mission or
He did,
what
he actually
oh,
that poor kid went through a lot before
wow.
he was on his mission. I mean, he had a hand break. He broke his hand at the MTC. He had the Bell's palsy. He gets out to his mission in the Philippines. Things are going well.
Oh
COVID
yeah, in
hits.
Philippines?
Yep, he went to the Philippines. Yeah, he went to the Philippines. COVID hit, and the government was like,
Oh yeah,
they
they
had to,
have to be pulled out.
and they were getting really aggressive, and they had to get him out very carefully because of the crackdown, and he ends up coming back home and then ends up going to finish up his mission in Arizona. So he went through a lot on
Yeah.
his mission, but
I really wanted to know where in the Philippines he was assigned to.
girl, I'll have to ask because I can't remember
Yeah.
off the top of my head where it was. I'll have to
Yeah.
ask him and then let you know next week because I
I
don't
think
remember.
yeah. But I'm from Ordanita Mission.
Yeah, I'm gonna have to ask and be like, dude, where'd you serve your mission? I can't remember where you served because I know it was the Philippines, but I can't remember exactly which mission it was. So,
There
and
are
then,
lots, and you can really like the words will come into your mind, but of course, because you are not familiar with that
oh
place,
yeah,
like "Oh, I know that one, but wait, let me find it in my
I was like,
yeah
what? I'm like, I know it was somewhere in the
yeah
Philippines. My brain
yeah
just went, I don't remember. He and one of his friends both served in the Philippines, but in different missions at the same time. So it was kind of funny. I was like, wow. So there we go. Now I've got where all my notes for the Bell's palsy. I was like, where'd it go? I have that.
yeah.
So we figured out it's Bell's palsy. So obviously,
Mm. The
diagnostic
diagnostic procedure,
procedures are going to
yeah.
be the clinical picture of the sudden unexplained onset of the facial paralysis. Will obviously suggest the diagnosis, but then it says, as always, you got to do the examinations of physical and neurological. So just to kind of verify the nerve function and everything like that. So it does say that it has to be differentiated from CVA or AKA stroke or an autoimmune disease because there are some autoimmune diseases that can cause some weird paralysis and stuff of the face. So that makes a lot of sense. But I'm glad that I was right on that because I was like, I think that's what it is. I was like, I don't have to look up too much information, I don't think. So let's see. Okay, I had to go down to where the notes were about the treatment. So I love that in the complementary therapy, it was like facial exercises and massage are recommended to prevent contractures. I was like, I only could imagine what the facial like exercises would be. I'm like, you know. I love that it said that though. Facial exercises would be great. So it looks like this it says antiviral medications and anti-inflammatory drugs may be prescribed if the etiology is found to be viral. Affected portion of the face, particularly the eye, must be protected from trauma, wind, or temperature extremes, which would make sense. If you can't, if there's paralysis in your face or you can't close your eye, you gotta, you don't want other infections causing other problems. So that would make sense. But yeah, look at that. We did it. Yay. We knocked it out of the park.
Yay! Yay!
I'm still giggling about the fact that we both were doing stroke as a case study.
Me too.
That will forever be my favorite thing in our group meeting so far is that I'm like, I was thinking, I'm like, how long is it going to be before we both decide on the same thing? And you wouldn't think it would happen because there's so many diseases and disorders listed, but
Exactly
I'm
right.
like, I wonder if she's feeling the same way I am this week, that this was hard week for studying. And so I was like, I wonder if she feels the same way. And then you're like, yeah, my case study was stroke too. I was like, there we go. We got to that point. Week 7. Well, awesome, awesome. So I will get everything finalized, notate and everything like that, and get it submitted. It may not be tonight
Yes, it's all
because I gotta
right.
go eat dinner because I didn't have time to eat before the meeting. So if
Oh
I
yeah,
don't
wait.
get it done tonight, I will definitely
You
get it
did.
done
Yeah, I
tomorrow.
really appreciate all the hard work that you're doing with both of us. I really
Oh,
appreciate it, and thank you, Steph,
of
for
course. Like I
yeah.
said, I love it.
I
This is one of my favorite groups I've ever been in. I have
oh,
been in other groups before and just have not always had the best experience, but this group with you, we, you know, we have very good, you know, interactions with each other.
yeah,
We understand each other, even if there
yeah.
is a little bit of a language barrier. It's, I understand, you know,
Thank you,
completely.
and
And
thank you for your patience with me.
hey, I struggle with English, and English is my first language. So sometimes I forget words or don't know what I'm trying to say. So if you can be patient with me, I can be patient with you. It's all good. But no,
Thank
it's
you.
like I said, I've been very lucky this semester. I've gotten 2 groups that are just really great.
Yeah.
I have this one with
Mm.
you, and then I have my economics class, who is a smaller group, and now just is I think down to just 2 of us because the other person in the group for a second time in a week has not shown up to the meeting. So it just is me and this other dude in that class, and then me and you in this class. So it's not as stressful as it normally would be in a group setting. So yay.
Yay.
But thank you, thank you, thank you
Yeah,
so
thank
much.
you.
And I just appreciate what you do on your side.
Oh, thank you. We really need to review because 100 is score. I mean 100 a quiz will come again with this week, and it
I
is
know.
yes.
I'm like, I gotta get my
I
crap
really yeah,
together.
I really have to maneuver my grades because
I know.
I hope I like at the end of the this semester I hope that I can have C. So right now I have a D minus. So hopefully. Let
Yeah,
me see.
that's why I'm like, please, please, please.
Yeah, but on the other one, on the other course that I have, I already failed, but I will be doing that until Friday, the instructor said. I don't know
Yeah.
if I can, but I will try my best. So
Like I
even though I
said,
don't have a C grade in there, it's okay. As long as I will have a C on the
uh,
elective one.
it's just, it can be hard sometimes, but don't ever think that you're not doing your best. It can be sometimes you get a tough class and you just can't, you know, get that C average. It's okay. You just take a step back, take a deep breath, let it out, and just kind of have that moment of saying, it's okay. I can do better next time, but I am still a good person. I'm still doing my best. Don't ever discount yourself because I used to be very aggressive with my and very mean towards myself when I started college. So I was like, if I didn't get a good grade, I was like, you're so dumb. And like I was mean to myself. So I'm like, nope, I need to change that method of thinking because that's not helping. So I kind of was like, okay, focus on what you can do your best. If you can't get the C or the C minus, take it again. It's okay. So you got this. We got this. We can do this because we're awesome.
Oh, thank you so much for your words. Really inspiring. Thank you. You let me remember that I have not to be harsh on myself, really.
I have to
Yeah.
remind myself every day. There are moments where I get very aggressively angry and I'm like mad that I'm not doing well in a class or something, or I'm struggling at work or something. And I'm like, no, 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 you're going the wrong way, Britt. No, 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 you're okay. I'm like, I feel like I demand perfection out of myself, and that's not a good quality. I demand too much out of myself, and I'm like, I can't be perfect. If I was perfect, I wouldn't be here because I'd be, living with Heavenly Father and everything like that. I'm imperfect and it's okay.
Yeah, I like it. Yeah.
But,
Thank you.
um,
Thank
well,
you.
awesome.
And you
Well,
need to eat now.
I I know. I was like, my dad's like, you're gonna eat. And I'm like, I don't have time to eat. I was like, I gotta. I was like, I tried to get the case study information done before the class, and I was trying to get dinner ready for him. I'm like, I don't have time to eat. I'll eat when done with the meeting. We're good.
Yeah.
So it's no problem at all. But you have a good rest of your day, and
Yeah,
I'm gonna
thank
have the
you.
good
And
rest
you
of
have a good
my
rest
night.
night too. Yeah.
I'm gonna try. All right, bye.
Bye.